Climate Action Week on weighing both the benefits and costs of AI on the climate and on health. I'm honored to be joined by our incredible panel of Harvard Chan faculty and researchers. They include Claudio Battiloro, postdoctoral fellow in the Department of Biostatistics, Francesca Dominici, Clarence James Gamble, professor of biostatistics, population and data science, and director of the Harvard Data Science Initiative, Nicholas Nasikas, a pulmonologist and researcher at Beth Israel Deaconess Medical Center, and Amruta Norisarma, assistant professor of environmental health and population sciences and deputy director of Harvard Chan Sea Change. If you have any questions throughout today's panel, please post them in the Q&A box, and we'll get to as many as we can in our last 10 to 15 minutes together on this panel discussion. So before we begin the discussion, I would like to start with a quick audience poll. And I'll just pause a moment for this to be pulled up. All righty. So the first question is a knowledge check for the audience. So how much water does asking ChatGPT to write a 100-word email consume? And your choices are 5 milliliters of water, about 1 teaspoon, 50 milliliters of water, about a quarter of a cup, 500 milliliters of water, about a 16-ounce bottle, or 5,000 milliliters of water, a 5-liter bottle approximately. And I think I will also ask you the second one now. So I believe you have to fill them both out. So the second one is more about your behavior. Do you moderate your use of AI tools like ChatGPT, for example, for concerns about the impact on climate? So yes, a little bit. Oh, I apologize. Slight change here. So how often do you use AI tools like ChatGPT in your daily work? Multiple times a day, once a week, rarely, or never? And just pausing to give you all some time to respond. I don't see the responses popping up. I think they're going to show up on the screen at some point. There we go. Okay, so for the first question, the largest group of you did answer this correctly. So asking ChatGPT to write a 100-word email approximately consumes about 500 milliliters of water. Estimated that correctly. And there's no right answer to the second one, but looks like this is a pretty heavy user of AI tools as a group. So about 50% of you are using AI tools at least once a day. All right, with that context, I'd like to move on to the discussion. And I want to begin with just a round robin. I'd like to hear from each of our panelists. In the context of health and public health, what do you find most exciting and what are you most concerned about regarding AI? Claudio.
Yeah, so I mean, this is a broad question, and I want to point out to something that I think will be useful even for the rest of this conversation, that is to fix some terminology. So, we talk a lot about AI, but I think there should be a difference between the broad field and the broad toolbox of AI and AGI, so artificial general intelligence. Someone says ASSI, artificial super intelligence. So we are talking about tools that should be able to match or go beyond human level of practically the broadest set of tasks as possible. So, when we talk about the why I'm excited about AI in general, I think it's because it has been proven to be very, very good at extracting information and learning from complex data, possible heterogeneous data, possible different in nature. So we can learn from images, from text, from audio, from time series, and we can learn from all of this data with even sometimes a single model. And I think that's super cool. And I think that most of my worries and the things that I see the most concerning about AI are about AGI. So, and this, of course, starts with, we will have time to discuss this more probably, but this, of course, starts with environmental concerns. And not only, I think there is also the root cause of all of my concerns, I think, stems from the type of business and development models that the current AI industry is actually employing. So I think that when things become too big and are in the hands only of a small group of people, that's never good. And this is what's happening with AI. And I'm telling this, and if I had to reply to that pool, I would say that I use ChatGPT more than once a day. So I'm aware of that. I also understand that they are very useful assistive tools. So I think this is one of the reasons why we are having this debate at this panel.
Right, thank you, Claudio. Ruta.
Yeah, thanks so much. I agree with a lot of Claudio's previous discussion. I think in my context, sitting in environmental health, and particularly the research that I do, which is focused on understanding the adverse health impacts of different environmental exposures, particularly extreme weather and climate-related exposures. And then also, how do we advocate for effective solutions to try and mitigate some of those effects? I see a lot of potential for AI to help in that process, as Claudio described, in the ability to kind of take in these massive data sets from across different areas, across different disciplines, across different data types, and use that to reveal things like environmental injustices that might exist in different communities, and use that to, simulate possible interventions and solutions to speed up the process of discovery. I think that those are some of the areas that I'm really the most excited about the potential of AI. But, in addition to the environmental risks associated with, the explosion in AI use, I think if we think about this as ingestion of historical data, there's a possibility for some of the biases that are inherent in those data to also get perpetuated as we continue to build out on our AI infrastructure. So I think for me, a lot of the concerns is, how do we think about and intentionally use AI to facilitate discovery and improve public health, while not simultaneously keeping an eye to make sure that we're not perpetuating historical inequities in the system.
Thank you. Nick.
Yeah, so I may be a little bit biased as a physician in my answer, but really, I believe that medicine, really above any other field, stands to benefit the most from AI. If you think about drug discovery, research, clinical care, healthcare administration, all of these can be augmented by AI. And if you think about it in the greater context here, where we really have an epidemic of physician burnout, 50% of physicians report burnout by just in 10 years, by 2036. We're expected to have a shortage of 86,000 physicians in the US. And I see a couple applications that are being used today where AI is trying to address some of the risk factors for burnout. And I'll give you a couple examples. The first example is an AI scribe that allows a physician to sit down with their phone while they're seeing a patient, have a conversation with the patient. It extracts the relevant information, puts it into a note without the physician ever needing to touch a computer. And you all probably have had the experience of going to your doctor and they spend most of the time clacking away at their keyboard. This is a way to really re-engage with patients, have a conversation, and get the relevant information into a medical record. So that's one application, these AI scribes. And then the second application I see is a tool that's already being used by many trainees, physicians, healthcare providers, to pool all of the incredible information that's being published every single day to ask questions about diagnoses and treatments. This is a tool that was developed here at Harvard and MIT, among other institutions, called Open Evidence. And I've really seen that as helping providers at any level of the healthcare setting really answer important questions using evidence-based medicine. So I really find this to be an exciting time, especially in the field of medicine.
Thank you. And Francesca.
Yes, well, first of all, thank you for having me, and it's lovely to join in this incredible panel. Well, I think I mean, of course, I agree with everything that's been said, and I spend my day and my week actually, in one hand, advocating and working and being very excited about all of the potential of AI to basically transform research across all fields, including the humanities. And Claudio is here, probably the only one among us that can also understand and code these large language model. And so their capability and the revolution in science into accelerating scientific discovery, again, across all fields, it's so exciting. And that's something I am fully involved and working on it. On the other hand, I also working on the potential concerning element of AI. And I think this is our elements that we're going to be touching on a little more. I mean, I think for me, the most pressing issues are the need for equitable use and sharing of AI tools. We are facing and we are seeing that in order to develop these tools and deploy these tools, it's incredible. You have to have access to incredible amount of computing power. And so only the very rich institution or rich environment can allow that. And then I think what we're going to talk about is the risk of deepening health inequities, because they can be trained often on data that is not representative of the population that are, from which we have less information. And then we were going to talk about the sizable environmental footprint of the AI infrastructure. So it is, I feel like in one day, super excited and really into the fast speeding train of let's develop the next AI that is going to give us the new drug, and they identify the new intervention for combat climate change. And then the other day, I'm working on another research paper, and I'm thinking, oh my God, the amount of electricity and environmental footprint of this AI is going to be really bad for us.
Thank you, Francesca. My next question is also for you and for Claudio, and the other panelists are welcome to chime in after. But to follow up on that, what do you see as the biggest public health and climate threats from AI?
So maybe let me just start and then I'll turn it to Claudio. I mean, I think we have been working on developing the first platform that it's a rigorous data platform. I always, being leading data science, I always talk about data first, right? And so we're building a data platform where we are taking information from all of the hyperscaler that have been built in the United States in the last few years. And then we are getting data also on the planned new hyperscale that are going to get new permit and be built in the United States. So these hyperscaler, and what our research is showing very briefly, is basically in addition of massive amount of electricity. Right now, they're consuming 4% of all of the national electricity. But what is more concerning is that the electricity that they need comes mostly from fossil fuel. So there is 58% higher average carbon intensity of the electricity that these AI hyperscaler use. And so what we are seeing in terms of the environmental and then health impact is that we know that every time it's fossil fuel is a CO2, is a PM 2.5, that we all know, and we can talk about with Nick and Amruta, they know even more than me, of all of the health impact of PM 2.5. But what it's really important to keep in mind is that the electricity that is now used to power AI infrastructure not only is increasing exponentially, but also it's still relying heavily on fossil fuel. And what we are seeing is, because of the political environment, we're seeing coal-fired power plants that were supposed to be decommissioned being reopened So then they can power AI infrastructure. And we know from our research that actually PM 2.5 from coal-fired power plants is even more toxic than fine particulate matter from all sources.
Yeah, I mean, of course, I kind of feel that everything that Francesca described is should be one of our most important concerns, but I want to broaden even a little the scope here and even a little the meaning of that we give to public health, like how AI can really affect us. And that's not only through environment, but I can think about how the labor market is gonna change, how the condition of workers are gonna change. And, I think it's a matter, it's a problem of public health that I can give you an example, and I really invite you to read the reportage that, for example, OpenAI has been exploiting Kenyan workers and to label their data. So imagine people that are not paid at all, working all day long in sub-Saharan Africa, and their only job is to watch violent or pedopornographic content the whole day to label those data. I think this is a huge problem, and when I talked about the difference between AGI and AI, I think that while the environmental problem is a matter of AI and AGI, when we go more on these aspects, we are talking already implicitly about AGI more, and there is even a more subtle aspect that I care a lot about AI and the impact that it's having. That is the fact that we have, people call it this bro oligarchy of tech people, and they are keeping telling us every day that AI is either gonna save us or is gonna cause an apocalypse. And this has already many problems, many public health problems implicitly, because on one end, okay, AI is gonna save us, but first of all, we should ask ourselves, who is gonna really save AI? Is gonna really save again white Western people, or is gonna really save everyone on the one hand? On the other hand, when there is an AI apocalypse, okay, we should really worry about it. I think that the long-term problem is a thing. I think that the probability that AI will take control to some extent on human being is a possibility. But on the other hand, we should not put all of our focus there, forgetting about short-term consequences, because the moment we worry about an AI apocalypse, we are already implicitly not making these people accountable for what they are already doing at the moment in the world. So Sam Altman went to the Congress, and what he asked the Congress for was, let's make sure that AI is not going to kill us in 100 years. But that's clearly a strategic move. If we just focus on that, we are not worried about what's happening now. We are not worried about what's happening to workers and to environment.
Amruta, did you have a comment as well?
Oh, no, I was nodding in enthusiastic agreement.
Okay, so because my next question follows up on some of the points that Claudio made, and if you could please start. What role do you see AI playing in exacerbating or alleviating health inequities?
Yeah, so I think the underlying thread throughout the conversation so far has been this concept of, maybe AI as a double-edged sword, I think. So maybe to continue along that theme, on the one hand, I think that there are potentials for AI to help alleviate some of the health disparities that we see as a result of environmental exposures. And, I think it goes back to the first question that you asked, Mary, which was about the possibilities from AI. So, using tools and building out on the data that we have available, we could use AI, for example, to help us identify populations that are disproportionately exposed to environmental burdens. Maybe we could leverage AI to help guide strategic allocation of resources to try and make sure that the communities that need the resources the most are really the communities that are getting access to those resources. I think that also I see a lot of potential utility more from a practical perspective of like the capacity for AI to really transform the ways in which we provide accessibility to information, right? So like even as a very simple example, if we have a heat intervention, one of the things that we're always thinking about is how do we translate that into local language, right? So imagine a heat intervention where we've developed the locally relevant temperature criteria, thresholds, identified who are the most vulnerable populations within different communities, and then we can translate it into many different languages to be representative of the populations that are living in those communities. I feel like AI on a very practical scale can facilitate some of those, very important things that I think we have not necessarily been able to accomplish before we had access to these large language models. But on the other hand, and this goes back to what Francesca has said, what Claudio has said, we need transparency. We need to understand who is sitting at the steering wheel, whose data is it that's going into the models? What are some of the systematic biases that might be inherent in those data, because we're learning from historical evidence, and we know that historical evidence has disproportionately been overrepresentative of some groups and underrepresentative of other groups. So if we're not careful, we could compound these existing inequities that we already know are inherent in our data through the process of generating these models. Also, we talk about increasing accessibility, but on the other hand, who has access to the AI tools? Who has access to this information? It's important to make sure that we want to improve equitable access to the flow of information so that people are not systematically disenfranchised through lack of access to the technology. And then finally, one of the things that we do talk about is that the solution that works in one context may not be the solution that works in every single context. And I think we have to really keep an eye on that because, we've learned this time and time again in the development of different types of interventions. What works in New York may not work in New Delhi, right?
Yeah.
So really, I think the takeaway for me is who's building the models, whose data is being used, who has access to the information, who's at the decision-making table. And these go back also to what Claudio was saying before too, which is that if we want to avoid perpetuating some of these inequities, it's not just about the AI itself, it's also about us as the actors who are leveraging the AI and how are we being responsible.
Thank you, Amrita. Many really important points. Do any of our other panelists want to comment on this issue of how AI can alleviate or exacerbate health inequities?
Just want to mention an experience that my team had doing a pro bono consultancy and advocacy for working together with the Southern Environmental Law Center, where they were basically there were a plan to build let me just say, so yes, was in a poor county in Virginia. There was the plan to build a 3,500 megawatts natural gas power plant to provide electricity to a mega data center. And what's happening in this type of negotiation is that the community is going to be impacted has very little information. What they were told in that context, they were worried, said, okay, you're going to build this huge power plant in our community. What's going to do to us? And what they were told by the developer, I mean, and this is true fact. I was at the city town hall, and the developer said that and said, "Well, it's going to be equivalent of you standing near to a grill for a couple of hours as the 4th of July." This was the information was given to them. Now, we came up and we did the full analysis, okay, and just look at calculating how much emission will coming from the power plant, looking her dispersion model, look how much PM 2.5, who is going to be affected. Well, what happened was we found that over 17,000, actually over 1.28 million people were going to breathe extra PM 2.5 just due to this new power plant. And we estimated that the cumulative healthcare costs for the next 10 years to this power plant was going to be $625 million. So this is what I mean, what I think also Amrut is talking about, the inequity of information and the misinformation. So this is not standing next to a grill on the 4th of July, right? And so that's where I think also the local advocacy and empowering, I think I always feel the public health it's also empowering the affected community with the information that they need to have, so then they can be informed in terms of how. By the way, after we published this report, this plan was withdrawn by the developer, right? It came back. So I think this is another element of democratizing information so that the community that are affected are not fed misinformation that is only to support the business interests of the developer.
Wow, that's a really powerful story. How did the community take your findings and then come back to the developer?
Well, yeah, what happened is we published a report pro bono. The community knew about it, and they presented at the town hall with this information. And the developer withdrew their proposal because at that point there was going to be so much community opposition that they will not let him do it. And so things like, it's not going to do nothing for you, and we're going to give you $10 million promise tax revenue, stand nothing compared to $600 million in healthcare costs in 10 years, right? Yeah. So this is the type of information, I think that's where public health can be really powerful.
Thank you for sharing that. Any other comments on this question? All right, I have my next question. Dr. Nasikas, Nick, if you could start us off in responding to how has AI benefited health through either climate mitigation or adaptation measures, or how do you see it benefiting health in the future?
Yeah, it's a great question. And part of it's getting at this idea that AI is going to be used for climate mitigation, climate adaptation. That will translate into health benefits. And at this point, it's too difficult to determine whether AI is providing a net benefit for health through climate mitigation adaptation. And that's for many of the reasons we've talked about right now, that it's dependent on fossil fuels. But there are signs that AI is being used for climate mitigation. Good examples of that include smarter traffic algorithms, improving industrial efficiency, improving energy systems. All these things can translate potentially into health benefits. And for climate adaptation, you think about extreme weather preparedness, improving crop yields. Those also can translate into health benefits. So with that said, I can give you a couple examples of how AI is being used right now to improve health. And the best example for this is probably in medical imaging. So GE and other companies that create these imaging devices, they're already integrating AI into all their machines. And this is being used to pick up early breast cancers with ultrasound, being used to pick up early lung cancer on CAT scans, or also looking at measuring different cardiac function on an echocardiogram. So AI is being used with existing devices that we use in the clinical setting to really detect, for instance, cancers at an earlier stage. And then researchers at MGB created an algorithm that could look at head CAT scans, and they found that their algorithm was able to detect acute stroke better than expert neuroradiologists. So there's already ways that AI is being used in medical imaging that are gonna benefit health. Those are things that are happening now. I'd say that I'm also really excited about the future and what it holds. And this is somewhat controversial, as Claudio alluded to, but with artificial general intelligence, there's this thought that what we could have accomplished in the next 50 to 100 years, we're now going to be able to accomplish in the next 5 to 10 years. So compressing the advancement of medicine that might have been accomplished over the course of a century, really over the course of a decade. And that's really exciting. And 3 specific examples of really how AGI could be used to really revolutionize the way we provide healthcare. The first example is CAR T immunotherapy. So CAR T takes your own immune cells to fight cancer without harming the rest of your body. And so AI is going to help identify some of these cells that are going to be better able to fight the cancer without harming the rest of your body. So CAR T technology, I think, is one really exciting development in AI. Another one is mRNA vaccine technology. We all became familiar with this during the COVID pandemic, but really there's a lot of potential for AI to improve mRNA vaccine technology to prevent and treat infectious diseases. And then the third big example, I would say, is curing genetic diseases with CRISPR technology. So I think there are exciting things that are happening right now, especially in the field of medical imaging, and there's also really exciting things that I think we could look forward to in the future.
Great, thank you, Nick. Any comments from our other panelists?
I I have to kindly disagree with your view, Nick, about this because I could also ask you why having AGI rather than three extremely good models for each one of the application you talked about. So, I totally agree that AI can do that. I'm totally on your side of that. I just don't see why we should do that with one big model that knows to do everything rather than three that are extremely good at what you need for.
And Claudia, you ask a really good question, and I'm not sure I have a really good response. If it turns out that the best way to approach these problems and answer the same question is with three separate models rather than one big model, I think then that's the path we should go. I'm more trying to express that there are things that we're doing right now where there's an application for AI to improve health, and there's also this application of really incredible future advancements.
100%.
My next question, I expect to get very different viewpoints to kind of, jazz the discussion up a bit here. And I'm also looking at the Q&A, and we have tons and tons of questions to fill the hour with. So I really appreciate the engagement of this audience. So my last question is for all of you to comment on how do we achieve sustainable energy usage to power AI, and do you think it is possible? I will begin with Amruta.
Yes, I think my short answer is I think it is possible. I kind of, in thinking through, and one of the questions that I think came into the Q&A box was, well, isn't the problem just data centers? Like if you fix the problem of decarbonizing the data centers or reducing the environmental burden, then is AI a problem? I do think that there's some other things that we have to think about in addition to, fixing the infrastructure around data centers. There's the selection of the sites for the data centers. Francesca talked about that a lot. Energy efficiency and storage is still a big problem, I think, and one that is still in the pipeline of being worked on. And then, we have all of the ancillary environmental concerns. So we talked about the air pollution exposure, but we haven't really gone into a lot of detail about water needs for cooling and how do we reduce the needs for, or, create different systems where we can reuse the energy from data centers and other applications. So I think there's a lot of different question marks that still need to be answered. But the thing that I think is really important is that all of this is a matter of advocacy work as well, right? So, as users of AI and as potentially, thinking through how we can be responsible users of AI, I think part of that is that we have to demand true sustainability in AI systems. So it's not just about carbon offsetting, right? It's about making sure that we want to use this technology, but we want to use it responsibly. And so I think creating those systems where there's community feedback, there's transparency in the process is really important as well.
Francesca, what do you think?
Oh, I mean, of course, how you can disagree with Amruta? Impossible. No, this is great and beautifully said. I think that we live in an environment right now where is go as fast as possible, go as big as possible, and there are 5 players, all men, they're running the show, right? And there are no incentive. Actually, we are the incentive is as big as possible, as fast as possible, and to eliminate any type of regulation and incentive to be sustainable, right? And I think that until we do a completely cultural shift where go slow, go far, go together. And so transitioning to renewable means it's taking longer time. That's why it's lower, right? And the incentive now is no, I need to reopen the coal-fired power plants right now because I need to power my next thing. I think Amrut is exactly right. It's not only carbon offsetting, there are many other things. Hopefully AI is helping, and we'll see if there is going to be a return of investment on technological innovation as well. I mean, we shouldn't, ignore that there is a tremendous interest into having new AI chips, new way of computing. Maybe quantum computing can help. The other thing that I want to mention, which is a phenomenal area of research that I really is going to explode, which I haven't been involved, which is what we call green AI in transparency. So there is a movement in the computer science literature, and hopefully it's going to be more broad, where we start thinking about how do we compute in a way that has that is more efficient. And so can we start having transparency in terms of that, instead of publishing the largest and fastest and more carbon intensive large language model, why don't we start incentivize the large language model that maybe is 0.2% less accurate, but is 300% more sustainable, right? And how do we see how in the way that we practice coding every day, including when the user can choose whatever platform they're doing in AI, maybe there is a transparency and say, if you use, I don't know, these particular chatbots, okay, maybe it's, 0.2% less accurate, but it's going to be, that also you're going to cut in terms of the carbon emission by 50%. And then to conclude, clearly the policy regulation and industry standard. I mean, this is now a new sector of the economy. And so in the same way that people have a driver license to drive a car, how about start having a license to use and to implement this very powerful algorithm? And the license could include sustainability, include responsible use of data, accountability, transparency, and so on.
Well, that's very interesting because I hear this theme in both your comments and Amruta's about the issue of incentives and the lack of the right incentives. And so are you suggesting some kind of licensing process that could create the kinds of incentives we're talking about?
Yeah, I mean, Claudio can speak to this, but I mean, there is a movement, but also in terms really of the field of the people expert in developing AI, it will be really wonderful to encourage entire career that will be devoted on use and computational efficient tool that will be sustainable as we are, really exponentially increasing the use of these tools.
Yeah.
Thank you.
I think I
Well,
wanted to, sorry, just to echo what Francesca was saying, but I think this is another theme that probably deserves to have more conversation and discussion, is that now is really the time to be doing this. And I think there's another question that came through in the Q&A, but it seems like it's reflective of historical, really major shifts in technology, where we need to start thinking intentionally about it now, because now is the time to put some of these incentives in place in order to make sure that what the infrastructure that we're building out is starting from that positionality of equity and of sustainability, rather than realizing it down the line, oh, we should have, and then retroactively trying to do that.
Thank you. Claudio.
Yeah, I would just to add and maybe wrap up a little what has been said. I think that we discussed a lot about the fact that we need technical solution, and that's totally true at all levels, starting from data center development to green coding or to the whole green AI movement in general. Then we need absolutely incentives and policies that that enables the development of the sustainable AI. And then I also agree, and I saw on the Q&A, and I'm totally on board on that this feels a lot like the social media boom. Probably it's worse than that. And now the state of things is going really fast. And I think we need regulation, even strong regulation at the moment, to slow down the development of AI. And I want to conclude saying something that Emily Bender often says. Emily Bender is a philologist that has been investigating the interaction of technology and the language, technology and society. And she says, when we talk about transitioning to sustainable solution, and for example, we talk about plastic, that's very hard because plastic is integrated in our everyday life at a very granular level. AI, if we don't change anything right now, is gonna be like that. But AI is not yet plastic. So we are still in the condition of regulating or slowing down on making really this technology going for good and not only for profit.
Yeah. Highlighting the urgency of the moment that we're living in right now. Thank you, Claudio. Nick,
Yeah, I think
optimism or cynicism?
Yeah. So, I agree that really the crux of the problem seems to be the energy dependence, right? The energy source is dependent on fossil fuels, and AI is going to exacerbate that problem. And I'll share some signs of optimism that I have, but I'll just first acknowledge that fossil fuels still dominate the global energy source. We're also confronted with the fact that 1.5 degrees Celsius is no longer achievable. Pretending like it is probably doing a disservice to public trust. But there are signs of hope. And I'll give you three examples from 2024. And the first is in 2024, and these are US focused. I could think of a lot of global examples, but in the US in 2024, renewables accounted for more than 90% of the total US electrical generating capacity added. The second is wind and solar accounted for 17% of the total electricity generation in 2024, surpassing coal for the first time. And then the third example is that battery storage doubled in 2024. So these are US examples, and there's a lot of really exciting global examples that I'd be happy to talk about. But I think the problem here is not a technology problem, it's really a policy problem. And it comes down to energy.
Great, thank you. So we are right on time. We've got 15 minutes, and now we're going to open it up to audience Q&A. Lots of questions. Some we're consolidating here. And I'm going to start with a question for Francesca and Claudio. So do you think this idea of green AI can fix the impact issues by looking at alternative energy sources and cooling systems? And are there ways to do this in an economically efficient way? And one attendee highlights the example of Japan currently building underwater data center for cooling benefits. Do you think that's something that's scalable, has the potential to change infrastructure on a wide scale?
So, well, Claudio, why don't you go first?
Yeah, I mean, I think this is still related to what we were discussing before. If you ask me if this has the technical potential to scale and to be a proper solution, I think that yes, we can work on it. Related to that, I've been seeing that there are a lot of technical works to how to actually attach new data set to the grid in a sustainable way, how to make sure that the capacity is met, how to make sure that we don't need to go much worse than where we currently are at. But again, to me, the success of a certain movement, of a certain framework that is mostly technical, passes through the possibility of having support from policymakers and politics in general. So, I mean, we can also discover nuclear fusion tomorrow, but if the regulations are not fast enough to be implemented and not equitable enough, we're not going to solve anything.
Yeah. And, to be provocative, I think this is the way to be in the panel. I mean, I don't know the answer to this, but I would be curious to know whether it's really worth it to invest the billion and billion of dollars we're investing right now to make larger and more closer to, models that will be closer to AGI, right? So right now, this is the tendency. We are, I mean, they 5 people are spending millions of dollars, billions of dollars, trillions of dollars to get closer to the AGI as fast as possible. Well, think about if instead of using the money to do that, we will pivot using the money to think about how to make the existing AI as sustainable as possible, right? And what would be the cost benefit of that? That's what I would love to see. It's like I don't feel this urgency that we get to AGI tomorrow. I'd be more than happy to wait 10 years to get to AGI, but then to spend the trillion of investment that is being spent right now to make sustainable the chat GPT and the large language model that we currently have. And I think that the climate tech could really bring us, or as you mentioned, like other way of cooling, alternative source of energy, renewal, investment in solar panel, going on and on. And that amount of money will go really far.
Thank you, Francesca. Giving me a lot to think about. I have a question that any panelist can answer. So what actionable steps or measures are there that climate activists can take looking forward to try to ameliorate large-scale environmental ramifications of a continued explosion of the data center industrial complex? What can we do?
I can go with some quick hint that is for sure start by prompting less. That's one. And again, I will commit to that as well. I say that I use ChatGPT more than once per day. And then I would say this must be a joint bottom-up and top-down approach in terms of activism. So we need strong lobbying on governments and policymakers, and on the other side, we need even stronger activism that comes from community. And so community needs to clearly state, needs first have the access to the information to understand how dangerous certain things are for them, and then they need means to raise their voice and speak up about them.
Amrita, do you have a comment on how people can be effective activists?
Yeah, I think I see an opportunity here for, going back to what we were talking about earlier in terms of creating a regulatory schema or a framework. I think that if we right now demand transparency and accountability for, pushing for standardization of reporting on, and public disclosure of some of the things that we've been talking about, like public disclosure of water usage, of cooling needs, of land use, of emissions, monitoring of all of these different activities and site-specific reporting instead of just reporting things in aggregate. I feel like that initial push for transparency and information could really help to build out an equitable regulatory framework. And I think, I agree. I don't see the urgency to build better and better models without creating the sustainability piece in hand. And I think part of that is working on making sure that when we, I often give this example, but in 2008, I was working in an investment bank in my first job out of my undergraduate training. And at the time, people were worried about this, what is going to happen with mortgage-backed assets. And it turns out that everyone was using a model called the Black-Scholes model. And it was kind of this big black box, and nobody really knew what it was or what was a part of it, but they were using it to price these really, really complicated securities. And people were wondering at that point in time, what's going to happen? Is there going to be a market crisis? And I think, so it's not just transparency around, the information of what's being used, but it's also transparency around the inputs and the information that's going into these large language models, or, as we keep moving further and further towards AGI. And I think that, other things that we could think about is coalition building. I find that in public health, we often talk about building coalitions so that we can understand the broader impacts, not just on, particular subsets of the population, but people can work together to kind of advocate for these different solutions across impacted communities. And so I think that, AI is going to have so many different effects on so many different vulnerable populations, whether it's from the siting of the different facilities or whether it's from the use of the data that we're pulling out of the AI models. So I think, starting now to build some of those coalitions in order to do that advocacy work is really important. So those are the two that I would highlight.
Thank you. Nick, you're
Yeah,
a physician, you're an advocate. Please go ahead.
Yeah, I might just add that, I don't know that this requires a totally different answer than what we've been doing to address air pollution and fossil fuel energy consumption. That there is a well-trodden path of advocacy to really promote the transition of renewables. And I think that's what we need here more than ever. And so if you're wondering if we need to create a new advocacy pathway to start addressing the effects of AI, I might say that it really can build on all the work that we've done to try to bring attention to the adverse health effects of air pollution related fossil fuel combustion.
Great, thank you, Nick. Actually, my next question is for you, and others feel free to jump in. But do you think the ability of AI to improve our climate and health systems outweighs the negative impacts? And a parallel thought experiment here would be, quote, are computers worth the energy and water they consume? Why or why not?
So I guess I would lean on my optimism here, and maybe it is a little bit, I don't want to say disingenuous, but what I would say is that I am optimistic in the long term that we have the technology. We have the technology to use renewable energy with solar power, with wind power, to really, I think, power our economy, power AI. It requires significant investment and policy changes to really make that happen, changes in our electrical grid. But I believe that we have the technology to do that. It's a policy problem. And so I think, I would say that, looking at all the benefits that I talked about, either the benefits that are here now with medical imaging, with helping with physician burnout, things like that, and the potential future benefits, it really, I think it's hard for me to say that we shouldn't continue to push for those advancements in health, but while at the same time addressing our dependence on fossil fuels.
Yeah, maybe if I want to add, I'm also cautiously optimistic, and I think that one potential benefit that I see it for the use of AI, not necessarily general, AGI, artificial general intelligence, but really from the toolbox. We have been seeing the ability to combat climate mitigation and adaptation, especially in developing country where we have very, very little information that comes on a tabular. Working with Claudio closely and try to better understand the capability of this model, I think one thing they really deliver is the ability to really ingest these multimodal data, like satellite images, text images, text data. And so we have been working closely with our colleagues and my colleague Chris Golden, who leads a large study on climate and public health in Madagascar. And so it's really fascinating to see how the ability of AI can really start helping us understanding area of deforestation and try to understand and combat the issue, even with food security. I mean, I'm sure there are million and million of examples. So I think that we could really advance and save so many lives by using the technology of AI in low resource setting. And I think that, again, in terms of investment, I really would love to see a lot of this increase of revenue in AI to really seriously fund $1 billion project that could revolutionize the entire healthcare system of entire countries. And so that you will see that then if you're creating a public health digital system with AI as a tool can inform, humanitarian crisis. I mean, we can talk about that for hours. You can see where the the balance, right? I mean, it's okay if maybe New York City, they breathe a little bit of more pollution, let's say that way, right? So that's, I think, the way I think about it.
Thank you, Francesca. That is really powerful. And I have a follow-up question I'm going to send to Amruta, given her experience in the private sector and Francesca's discussion of investment. So given that we have yet to see large-scale profitable technologies be rolled out in truly equitable ways, should we in public health actually be encouraging and cheerleading private companies to push AI tech forward before regulatory guardrails are established?
That's an interesting question. And I mean, as a public health person, I think my natural inclination is to say, no, of course we shouldn't. Of course we need proper regulations in place that are informed by all of the different specialties that are represented here in the panel, plus the community perspectives, plus the, local perspectives. I think it's really important. I think that, it's challenging. So there's the universe of things that we know, and there's the universe of things that we know we don't know. But I think the things that still bother me are the things that we don't know that we should be regulating, but we don't even know that these are the things that we need to be regulating. And I think those will start to unfold in the coming years. But I think one of the benefits of what Francesca, I think, is advocating for, which is slowing down in the process and taking some time to understand and maybe invest in some of these strategies early on. I think one of the side benefits of that is then maybe we can start to identify some of those unknown unknowns so that we can address them head on.
Thank you. All right, we have 2 minutes, and I have one last question. If you could all keep your responses brief, but in your role as professors and teachers, how do you guide your students in the use of AI? Is AI changing how public health students learn to absorb, analyze, write, communicate effectively, and with accuracy about public health information?
So maybe I'll start off. In one of my previous faculty positions, I started a certificate on climate and health, and the course that I taught was on climate and health equity. And we had this discussion at the beginning of every session that I taught for a couple of years. And my point to my students was, so first of all, I think people don't realize, at least until now, sitting in the position of a faculty member, you can kind of tell when students are using AI to supplement their answers or their responses. But the second thing I said is, you can use the AI, just tell me how it is that you used it. But also, I care about what you think. Like in the context of this conversation, in the context of the discussion that we're having. So you can tell me what the AI thinks, and that's fine. But I also want to know what you think, right? So that's kind of been my approach in teaching.
Nick, and you're teaching of medical trainees.
Yeah, so I work in the intensive care unit, have medical students, residents, PA students, NP students, and I'm very open to people using AI to help with questions that they have about the diagnoses or treatments that they're confronted with. And I think I'd echo what Amruta says. I always ask them to be open about using the tool and what they think the tool is adding to what they already knew, or maybe what the tool is saying that they don't agree with. And so I agree, being open about the use of AI in the clinical setting, I think is important, but I'm open to it.
And Francesca, you get final comments, please.
Oh, very simple. I mean, use it responsibly and use it to enrich your opinion and not to replace.
Well, everyone, thank you. I'd like to thank our outstanding panelists for this very interesting discussion and the urgency of the moment that we're living in. And I'd like to thank the audience members for your attendance and for your engagement. This is Harvard Climate Action Week. There are many other events and seminars, both virtual and in person, that are open to anyone. And I encourage you to attend as you are able. And thank you all very much.
Bye-bye.
Thank you.
You.